We have been talking about missing teeth and what they do for quite a bit. Dr. Nucci, tell us, what are the current major, 1, 2, or 3, whatever it is, methods of replacing them, and give us a little big picture, or a layman's type of picture, when one is better than the other one, or more applicable, and what are the features of each replacement are.
Well, what I tell my patients when they come in, they're missing a tooth, I tell them what I would want for myself. And the first thing that I would want and that I would look for if I were missing a tooth would be an implant. Because an implant has an excellent success rate over a long period of time. They are freestanding. They don't affect anything else. They preserve the bone, and they look and feel, the teeth that are built on them look and feel like your own natural teeth. If you're missing one tooth and an implant is not possible, then the next choice down the line would be a bridge. And a bridge is an excellent option. It uses the tooth in front and behind for support, but we can build a highly aesthetic, means it looks just like your other teeth. It will feel just like your other teeth, with the one difference being that it's tied together to the other teeth. It's not freestanding, so you can't floss in between. And that's a downside of it, and that's why I don't put it at the top of the list. But it is an excellent choice, and it's what has been the bread and butter in terms of dealing with missing teeth over the long period of time, because implants have only come onto the stage over the past 20 to 25 years. Last on the list, it's still a workable option, but it's last on the list would be a denture. And a denture replaces a tooth by having something that comes in and out of your mouth, kind of like a retainer that a child would wear with braces, kind of like what your grandfather had. It is an option. It does its job, but it's a foreign object that you take in and out, and that's why I place it at the bottom of the list. It works. If it's the only thing available, then that's what you need to do. And there are many places throughout the world where that is the only option, and that's what people function with. So those are the 3 main options that we have. And they all work. They go in order from higher expense to lower expense, and they go in order from more comfort to less comfort.
Okay. Tell me, you said that if it's not possible to put an implant in it, then a crown is a bridge is a very good option. When is it not possible to put an implant in it?
Well, implants need bone for support. So if a person has lost too much bone, if they waited too long, or if their bone was damaged for some reason, if they were in an accident, and there's not enough bone, unfortunately, we can't place an implant. We don't have enough support for it. Sometimes we can add bone, and that's a different type of procedure, and often that is very successful. It can't be done 100% of the time, but often we can augment or build up the bone to place an implant. But to answer your question, an implant can't be placed when there's not enough bone there.
Okay, got it. Now, you also said that on a bridge, which is basically two teeth, holding another one hanging down, and they're melted or welded together or whatever, and thus you said it's difficult to floss there. So is that one of the reasons why sometimes you say that a bridge doesn't hold so long, because a person develops gum disease in that area? Since, there's people out there like me, when I brush at night, I brush, I shower, I shave, whatever else I do, and my wife is still brushing. You get the idea, okay? So people like me, if I would have a bridge, I'm not so sure I would be, starting to fiddle around and floss below it. I would probably floss very little in that area. Would that hurt me, and would that endanger the bridge and make it failing and coming off faster?
If it's like everything else in our mouths, if we don't keep it clean, it's going to have problems. And bridges will collect plaque. They will collect all sorts of little pieces of debris and all the little hiding places that we don't reach with the brush. So brushing just gets what's accessible, but you need to spend the time flossing. And that's part of the problem and issue with a bridge, that you have to do the types of things that you just said you don't want to do. You have to use a floss thread or a brush to go underneath and spend the time scrubbing. If you don't clean in all those little hiding places, then you can, not that you will, but you're more prone to developing problems like more decay and more gum disease. And that's why bridges have a lifespan of about 10 years on average.
And what about an implant? What's the average lifespan of an implant, give or take? I mean, I know there's no real number you can put on it, but, a good average lifespan.
The studies that have been done show that over 20 to 25 years, the success rate is in the 90% range in terms of the implants remaining in place. Implants don't get decay. They don't get gum disease. They get a type of an inflammation around them when a person doesn't cleanse properly. But they're normally, when we're talking about a single tooth implant, they're freestanding, so they're easily cleansed just as your own teeth would be. And the problems around them are much less in terms of what we face with our own teeth. So they're, in a lot of ways, much easier to deal with.
Well, that's a big difference. I mean, an implant, on an average, from what I understand, is a little bit more expensive than a bridge. But at the same token, if it lasts, from what you say, pretty much twice as long, it looks like on the long run you're again much cheaper off with the implant, never mind they're having to do it all over again. I mean, that couldn't be a pleasant thing.
Well, that's part of why I put it at the top of the list. If it was my choice for myself, I would want an implant right away if I was able to do it. If I had enough bone, or if the bone would be easily augmented or strengthened in order to place an implant. And they really aren't that much more expensive. A 3-tooth bridge and a 1-tooth implant, maybe you'll spend 10 to 20%, 10 to 15% more in terms of doing the implant. But the value of that and the worth of that over the long term far exceeds the cost in terms of my thinking.
Right. Well, I mean, we are and have been talking about the enormous danger of gum disease. So in my humble opinion, just thinking of the fact that they open the door a little bit more for a gum disease on a bridge because of flossing becomes difficult. And that alone, knowing what you mentioned about what we talked about gum disease in itself, should make most people wanting to go for implants. Well, again, Dr. Antonucci, thanks for shedding some light on that whole thing. We'll be talking more. I think we know why why implants are basically so popular, so successful for so many reasons. You keep your bone intact, so you're not shrinking and starting looking ugly. They hold longer. By doing so, they're tremendously cheaper because they're not even that much more expensive in the first place. You avoid gum disease easier, not completely 100% because of it, but it's slightly easier to avoid it. Looks like a good thing. Looks like technology has done a good thing here. And they are successful. They work. That's the bottom line. They work, and they are being pursued by many people today. Yeah. So people don't get infections from having a foreign object in it, which is this titanium metal rod. I guess not, right?
Well, the body likes titanium. For whatever reason, the chemistry between the human body and titanium match. So it's something that's one of the reasons why implants work, because titanium works well with the human body. There's very little rejection. There's no rejection of the metal itself. It's not to say problems can't occur with implants, as with anything else that we do, but they're very minimal.
Dr. Antonucci, thank you very much.